Welcome to the introduction to the KaVo ESTETICA E70 E80 Vision dental unit. You have the option to watch the entire video or select specific sections. Sabine Ludwig will guide you through this introduction. The patient chair is designed for patients weighing up to 180 kilograms. The chair can be moved in 3 ways when the instruments are set down. The first option is movement using the foot control. If you push the cross switch forward, the chair moves up. Pull the cross switch back and the chair moves down. Move the cross switch to the left. The backrest reclines. Move the cross switch to the right. The chair's backrest moves upwards or forwards. The second option is chair movement using the dentist's element. Using the chair cross here, you can move the patient chair up and down and the backrest forwards and backwards. The third option for controlling the patient chair is the assistant element. The arrow buttons indicate the direction of movement. To move and adjust the headrest with the push button, press the button on the right and adjust the headrest accordingly. After releasing the button, the headrest is fixed in place again. It is also easy to operate from the assistant side. Alternatively, a motorized headrest is available. The movement of the motorized headrest is combined with the automatic positions of the patient chair. In addition, the headrest can be operated via the chair cross on the doctor or assistant element and directly on the joystick. The head cushion can be easily replaced with a comfort head cushion with magnetic attachment. Remove the standard cushion, attach the magnetic plate, then fit the comfort cushion. If you have equipped your E70 E80 Vision with a comfort backrest, you can adjust its height to suit the length of your patient's trunk. To do this, press the button at the top right and pull the backrest to the appropriate height or push it down. The right armrest can be swiveled forward. The left armrest is fixed in place. Both armrests are available as optional extras. The C-curve can be optionally configured with lighting. It can be deactivated in the settings. The dental unit has several safety functions. On the backrest, the bracket on the foot control, in the swivel area of the spittoon bowl, on the device cover of the ESTETICA E80, the step plate and at the foot end of the seat. If a safety switch is active, a red bar appears on the display and LEDs on the assistant element flash. Tap the arrow to display details. If a safety cutoff is active, the chair can no longer be moved. In the shock position, the patient chair moves all the way up and the backrest all the way down. This helps stabilize the circulation of a patient who feels unwell during treatment. The touch display of the ESTETICA E70 E80 Vision is divided into 2 parts. On the left is the user selection, as well as the control panel for manual patient chair movements and programmable automatic positions. Furthermore, each user can add individual functions to the home screen. The left part of the display remains visible throughout the entire treatment. On the right side, you can select the types of treatment. When an instrument is removed, its functions are displayed here. By clicking on the drop-down menu, you can select a created user. The language can be set for each configured user. Select Settings in the menu, User, then use the arrow key to select the appropriate user and language. The list of available languages is displayed. We select German here, for example. The adjustment takes a brief moment, then it returns to the overview. The language has been changed. We recommend programming the entry and exit position for position 0 and saving a lower jaw and upper jaw position for positions 1 and 2. The positions can be saved individually for each practitioner. This is how the chair positions can be adjusted. Manually move the chair to the desired position. Once the position is reached, press and hold the button you want to program for 4 seconds. Confirm the save in the pop-up menu. The image on the display changes to reflect the position. Now manually move the chair to the desired position again. Press and hold the desired automatic button for 4 seconds. Confirm the save and repeat the same process for automatic position 2. To begin treatment, first move the patient into the appropriate automatic position. Then use the manual fine adjustment depending on the size of your patient. If you want the patient to rinse, you can move them to the rinsing position using the SP button. The treatment light turns off automatically. The cuspidor bowl is swiveled in automatically or manually, depending on the equipment. By pressing the LP button, the patient chair automatically returns to the last position and you can continue the treatment. The treatment light automatically turns back on and the cuspidor bowl is rinsed. With the foot control, when instruments are put down, the rinsing position can be activated on the right. The last position can be recalled on the left. All automatic positions can be called up via the assistant element. With the ESTETICA E70 E80 Vision, different modes can be selected on the chair cross depending on the equipment. By tapping the center circle, you can switch between modes on both the dentist's and assistant's side. The Ergo mode contains the settings for the motorized seat lift and horizontal adjustment. This mode is exclusively available on the ESTETICA E80 Vision. The headrest mode is displayed when the patient chair is equipped with the optional motorized headrest. The home screen can be personalized. Press Settings, select User, and then press the Home Screen button at the very bottom of the following menu. The home screen can now be customized. First, remove the buttons that aren't needed. Now drag all the buttons for desired functions downwards. For example, after the shock position, the bowl rinsing, mouth rinsing, cup filling, treatment light on off, the compo shape mode, and the screen lock. Alternatively, there's also a bell symbol for connecting to a door opener or doorbell, for instance. The newly set up home screen can be seen directly on the treatment console. We recommend designing the home screen the same way for all users, so that the assistant always has the same screen in front of them. Not all home screen positions need to be filled. A short press of the mouthwash cup button fills the cup. The fill volume of the mouthwash cup can be set and saved by pressing and holding the mouthwash cup button on the home screen for 4 seconds. The save menu opens automatically and water starts flowing into the cup. By releasing the button, you determine the fill volume. The bowl rinse can also be activated on the home screen with a short touch of the button, and the rinse duration can be set and saved with a long press. On the home screen, press and hold the bowl rinse button for 4 seconds. The memory menu opens automatically and the water starts to flow. By releasing the button, you determine the rinse duration. The filling of the mouthwash cup and the bowl rinse can also be activated and set in the same way on the assistant side. The touch display of the doctor and assistant elements can be locked simultaneously on the home screen. To do this, press the button with the lock icon. The screen lock is used, for example, when cleaning the display. To unlock, the main pedal of the foot control must be pressed for 2 seconds. It is also possible to lock the screen from the assistant element. Simply press the KaVo logo. The ESTETICA E70 E80 Vision offers the option of pre-selecting 3 treatment types and saving parameters. The blue bar in the drop-down menu shows excavation, preparation, prophylaxis, and manual. The treatment types, except for manual, can be individually renamed in the user settings. All other menu items displayed are optional accessories. For example, select excavation. Excavation appears in the blue menu bar. The instruments used and individual parameters can now be saved for this type of treatment. Here, remove a turbine instrument from the quiver. The speed can now be adjusted using the slider. To save, press the Save button. The spray behavior can also be saved. Spray off, spray on, or air only. When removing the turbine, the preset speed is displayed. By clicking on the 1 per minute, the speed setting can be changed to a percentage. The same applies to a motor. The desired speed is selectable and adjustable. Select motor left or right rotation and save the parameters using the Save button. In manual treatment mode, no settings for air instruments and electric motors are saved. They can be set individually for each treatment using the foot control. The center positioning of the foot control is deactivated for this purpose. When removing the instrument, the values that were last used are recalled. The power of the E-scaler can be adjusted in 10 levels using a control. The power can also be regulated via the foot control. Please observe the recommended power settings. The water volume can be adjusted on the regulating ring. The handpiece can be easily and securely attached to the hose in the specified position. The front grip sleeve can be easily unscrewed, allowing the light guide and LED module to be replaced in the practice. The left button of the 3 or multifunction handpiece controls air. The right button controls water. Pressing both buttons together produces the spray. For the multifunction handpiece, the heating of the media can be pre-selected on the display. 5 different timers can be programmed in the timer menu. To set a timer, press the arrow button. Adjust time during countdown. Press Confirm. The setting is saved. To start the timer, press the large button. Even if you exit the timer menu, for example for treatment, the countdown remains visible in the status bar. Alternatively or additionally, a stopwatch can also be started. It is also displayed in the status bar. To stop, press the large button again. A signal tone sounds when the timer expires. You can start your patient communication via the Multimedia tab. Detailed information on this can be found in the separate videos on the multimedia systems and intraoral cameras. The dental unit offers a range of automatic cleaning programs, including intuitive step-by-step instructions. In the Hygiene tab, tap the Cleaning Position button to move the chair into the cleaning position. Then select the desired cleaning program. The relevant hygiene guide appears on the display. You can see further steps of the hygiene processes in the detailed hygiene video. The settings area is divided into personal user settings and general settings. Up to 6 users can be created in the personal settings. The username can be renamed in the user settings. The first 3 indications can also be renamed. Additionally, you will find language and light settings here, as well as selection buttons for the personal home screen. In the general settings, you will find, among other things, information about your dental unit and the contact details of your specialist dealer. The arm system of the dental unit is adjusted so that it remains at any height when normally loaded. To maintain stability, even under heavy loads, the arm system features a floating brake that can be adjusted using the screw. The dentist element of the ESTETICA E70 Vision is also available as a swing arm. The display is operated in the same way as the T-table version. Only the size and orientation of the display are different. The instrumentation is freely selectable, and the swing arms are available with or without a locking mechanism. The version with detent setting has 3 detent positions. Pull the instrument to the desired latching position, pull the rocker slightly forwards to return and put the instrument down again. To achieve maximum hose length, fully extend the swing arm and it will lock into place. Pull once more and the swing arm will retract. The optional tray holder can be mounted in 4 different positions on the underside and can be flexibly positioned. The foot control of the ESTETICA E70 E80 Vision offers a wide range of functions. For example, the saved treatment types can be selected and cooled up using the main pedal when instruments are stored. Once the required treatment type has been selected and the instrument has been removed from the holder, the speed can be controlled using the foot control. In this case, for an electric motor from 100 to 40,000 revolutions per minute. The main pedal automatically returns to the center position and starts at the preset speed when activated. In manual treatment mode, there is no center positioning for the foot pedal. The speed can be infinitely adjusted by moving the foot pedal horizontally. The pedal remains in the position and therefore at the speed at which it was last operated. The left button of the foot control switches the spray states when an instrument is removed. The cross switch in the middle of the foot control activates counterclockwise rotation for a motor. The right button activates a chip blower function for rotating instruments. The enhanced air blast safely and quickly removes debris from the preparation site without activating the rotating movement. When instruments are stored, the chair functions can be controlled via the foot control. If you have equipped your ESTETICA E70 E80 Vision with a wireless foot control, a warning message will appear on the touch display if the battery charge is still at 30%. Additionally, the foot control emits a beep signal each time it is activated. The wireless foot control can be easily recharged using a plug-in power supply, for example, overnight. The on-off switch usually does not need to be operated. It is used to restore broken connections between the starter and dental unit. The treatment light can be switched on or off using the light button on the home screen display. The compo shape mode can be controlled using the compo shape button. The same control options and buttons are also located on the assistant element. The KaVo lumina can also be controlled via the sensor on the lumina. Move your hand past the sensor to switch the light on and off. If the hand approaches the sensor briefly and is removed again immediately, the compo shape mode is activated. This activation is also possible directly from the switched-off state. Further details on the adjustment options and operation of the KaVo Lumina can be found in the Lumina instruction video. The assistance element can be adjusted in steps. After reaching the highest position, the element can be returned to the lowest position. Operation is the same as for the dentist element. Manual chair movement, automatic positions, flush position, last position. In addition, light control, mouth rinsing cup, bowl, and the first 3 timers, as well as the display lock for the doctor and assistant element with the KaVo logo. An additional tray shelf can be fitted as an option. On the Physio Evo, there is a lever under the seat at the front left. To adjust the chair height, pull the lever. The backrest can be adjusted using the rear lever. Press down and lock into place. The backrest is movable. Pull up again and the backrest is fixed. The lever for adjusting the tilt angle is located on the right-hand side. Press the lever down to adjust the inclination. Pull up again and it is fixed once more. The Physio Evo F has a footplate for height adjustment. It can be operated with the heel. When the footplate is pressed, the height can be adjusted. When it is released, the height is fixed. That was the introduction to the ESTETICA E70 E80 Vision. We hope you enjoy your new KaVo masterpiece.